My name is Dr. Edward Cheong. I'm a senior consultant and working for over 30 years in upper GI and general surgery at Farrer Park Hospital. My main love is to talk about minimally invasive or endoscopic surgery for esophagus and stomach, and also prehabilitation, which is preparing the patient for major operations. Prehabilitation is preparing a patient physically, medically, nutritionally, and mentally before a big operation. It pays off if you prepare yourself better before the operation. They do better, they heal better, there's less complication, shorter length of hospital stay, faster recovery, and they get back to their normal activity of daily living. Prehabilitation consists of cardiovascular exercise, and by that I mean of brisk walking or fast walking for 30 to 45 minutes at each episode, and try to do this every day. It also helps prepare them medically. For instance, if your diabetes is not well controlled, then control it with medication and eating less sugary food or sweet food. It's also to provide them with information mentally. They can prepare them before the operation. And the key thing is that this is not only just before the operation, it's also for them after the operation, which means that for the rest of their life, they actually do better by eating well, training well with the exercise. Ideally, yes, because prehabilitation doesn't stop when your operation finish. Ideally, you try to teach them what they can do to make themselves better for the rest of their lives. So the ideal thing is yes. These are what we call teachable moments in your life, and you have this opportunity as a doctor to change what they do. Anxiety and mental stress is quite common and normal before a big operation, and the patient can prepare themselves even better when they do prehabilitation or physical, medical, and mental preparation. This will allow them to do better, so that will also relieve their anxiety, and it allows them also to focus on what they can do before a big operation physically, so cardiovascular exercises, so that they improve and they are optimized by the time they come to the operation. And these are their marginal gains, if you like. These little marginal gains and the teachable moments in life are exactly what we try to do in the clinic to prepare the patient. But it often doesn't happen in one sitting, so we get the patient back again and again and remind them, talk to them. Are you doing this? How are you doing with that? Don't eat unhealthy foods. Avoid things like refined sugar. Go and eat healthier food just to get your blood sugar better controlled so that you can heal much better. It's common, those anxious moments, but it's also important to reassure them, educate them that those simple cardiovascular exercise, fast walking, brisk walking, are not going to exacerbate their problem. It's going to make them better. Those simple things are doable, and that's what you want in the prehabilitation program. Simple exercise, eating healthy, and of course, the constant reminder of what they can do. And of course, they can ask questions. Is this good for me? Is that bad for me? So it's normal to have those anxiety and worrying that it's going to exacerbate their problem. But most of the time, they do very well with the prehabilitation. And avoiding them is not a good idea in general. At the end of the day, with any medical conditions, try to listen to your body. If you've got any symptoms, look for help earlier. The earlier you seek help, the faster you recover and the faster you get well. So it's very important to listen to your body.